What are the symptoms of cholesterol problems? A high level of cholesterol in the blood doesn't have obvious symptoms, but it can increase your risk for conditions that do have symptoms, including angina, chest pain caused by heart disease, high blood pressure, stroke, and other circulatory ailments. Also, soft, yellowish growths or lesions on the skin called xanthomas may suggest elevated levels of cholesterol. Many people who are obese or have diabetes also have high cholesterol. In men, impotence may be caused by arteries affected by too much blood cholesterol. What you can do. Learn the basics. Your cholesterol isn't just one number, but several that together give your doctor a lipid profile. Unhealthy levels are linked to hardening of the arteries, which can cause heart disease, heart attack, and stroke. Your numbers include bad LDL and a good HDL, cholesterol, and triglycerides. Armed with this knowledge, and with the help and guidance of your doctor, you can start to understand and manage your own levels. Get tested, because unhealthy cholesterol numbers often don't cause symptoms, especially at first. It's important to get tested. You can be slim and feel healthy and still have a cholesterol problem. Once you know there's a problem, you can try to change it through diet, lifestyle, and, if necessary, medication. But you're unlikely to do that if you don't know about it. If you're 20 or older, you should get your levels checked, a simple blood test, every 4 to 6 years. Your doctor should test you more often if you're overweight or diabetic or you have heart disease. Exercise. Regular exercise is one of the best ways to control your cholesterol. You don't have to run a marathon. A half hour or so of brisk walking, swimming, or dancing 3 or 4 times a week should do the trick. If you're short on time, you can break it into 10-minute increments throughout the day. Resistance training, push-ups, pull-ups, weights may help too. Don't smoke. Smoking lowers good cholesterol, which means you keep more of the bad stuff, LDL. And it's linked to high blood pressure, diabetes, and heart disease. You can improve your cholesterol levels and help protect your arteries if you quit. Even if you're a non-smoker, it can help to avoid secondhand smoke. Maintain a healthy weight. Carrying too much weight, especially a visceral fat around your belly, can raise LDL and lower HDL. In general, a waist measurement of 35 inches or more for women and 40 inches or more for men could be a sign of trouble. But only your doctor can say if that rule works in your case. You may notice an apple shape because of the way you get larger in your middle more than other areas. But lose just 10% of your weight, and you could really help your numbers, possibly bringing them back to healthy levels. Talk to your doctor about the best diet and exercise program to help you lose weight. Limit saturated fat. This comes from beef, pork, lamb, and full-fat dairy like butter, cream, milk, cheese, and yogurt, as well as tropical oils like palm and coconut. All can raise your LDL or bad cholesterol. It can help to trim visible fat from meats, and to look for skim milk and low-fat yogurt. You shouldn't get more than 6% of your calories from saturated fat if your LDL is high. Avoid trans fats altogether, too. Treat underlying conditions. It's important to understand and treat conditions linked to a risky cholesterol or lipid profile like diabetes or obesity. Treat the condition itself, and you may help improve your cholesterol numbers as well. Your doctor can help screen and treat these conditions. Make sure you tell your doctor about all the medications you take and follow your treatment plan. Don't skip doses or change your treatment plan unless you talk to your doctor first. Call your doctor about heart disease if you find soft, yellowish skin growths on yourself or on your children. Ask about being tested for high cholesterol. You develop symptoms of heart disease, stroke, or atherosclerosis in other blood vessels, such as left-sided chest pain, pressure, or fullness, dizziness, unsteady gait, slurred speech, or pain in the lower legs. Any of these conditions may be linked to high cholesterol, and each requires medical help right away. The watching, interacting, and participation of any kind with anything on this page does not constitute or initiate a doctor-patient relationship with verypudic.com. None of the statements here have been evaluated by the Food and Drug Administration, FDA. The products of verypudic.com are not intended to diagnose, treat, cure, or prevent any disease. The information being provided should only be considered for education and entertainment purposes only. If you feel that anything you see or hear may be of value to you on this page or on any other medium of any kind associated with, showing, or quoting anything relating to verypudic.com in any way at any time, you are encouraged to and agree to consult with a licensed healthcare professional in your area to discuss it. If you feel that you're having a healthcare emergency, seek medical attention immediately. The views expressed here are simply either the views and opinions of verypudic.com, others appearing and are protected under the First Amendment. Verypudic.com promotes evidence-based natural approaches to health, which means integrating her individual scientific and clinical expertise with the best available external clinical evidence from systematic research. By individual clinical expertise, I refer to the proficiency and judgment that individual clinicians acquire through clinical experience and clinical practice. Verypudic.com does not make any representation or warranties with respect to the accuracy, applicability, fitness, or completeness of any multimedia content provided. Verypudic.com does not warrant the performance, effectiveness, or applicability of any sites listed, linked, or referenced to, in, or by any multimedia content. To be clear, the multimedia content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or seen in any website, video, image, or media of any kind. Verypudic.com hereby disclaims any and all liability to any party for any direct, indirect, implied, punitive, special, incidental, or other consequential damages arising directly or indirectly from any use of the content, which is provided as is, and without warranties.